New findings show that removing blood clots from an occluded brain vessel with a procedure called endovascular thrombectomy can be helpful for treating patients with severe strokes, even those with large areas of damage. However, past studies use advanced brain imaging techniques such as perfusion imaging, while most hospitals typically use a simpler method, namely plain computed tomography, CT. Our aim was to investigate whether the simpler method would also be effective as the main way to choose patients for this specific stroke treatment.
We demonstrated that using plain computed tomography is sufficient to select eligible patients with larger infarcts for endovascular thrombectomy. These patients recovered better and had a lower risk of death compared to those who did not receive the procedure. The trial was stopped early because we saw a benefit of endovascular thrombectomy during the first planned interim analysis.
With the trial results, we can now treat patients with large infarcts who were previously excluded from endovascular thrombectomy. By showing that plain computed tomography is sufficient for selecting such patients, thrombectomy can be applied more widely, even in hospitals without advanced imaging available.
We have strong evidence supporting the removal of blood clots by thrombectomy, even in patients with extensive damage. We are confident that national and international guidelines will be updated soon. We believe it will become a routine procedure in hospitals for treating acute ischemic strokes, since stroke centers all around the world have already started to include these results in their daily routine. This trial is an excellent example of international cooperation in the field of acute stroke research. We are thankful for running this trial at our site, participating in committee meetings, as well as interpreting and communicating the results. This has motivated us to foster our careers as clinical trialists, as it demonstrates how we can make important changes in the daily clinical practice for our patients.